Idursulfase is a medication used to treat a genetic condition called Mucopolysaccharidosis type 2 Hunter syndrome, which causes a buildup of a substance called glycosaminoglycan, GAG, in the body. Idursulfase works by breaking down these GAGs, and it may help improve your ability to walk. The recommended dosage of Elaprase 6 mg per 3 ml intravenous solution for metabolic disease enzyme replacement in mucopolysaccharidosis is determined by your doctor based on your medical condition, weight, and response to treatment. This medication is usually given once a week, and it's important to take it at the same time each week to help you remember. It is best to take this medication on an empty stomach, at least 2 hours before or after a meal. Remember to follow your doctor's instructions carefully and let them know if you have any concerns or experience any side effects. Before starting treatment with Elaprase 6 mg per 3 ml intravenous solution for mucopolysaccharidosis, it's important to read the patient information leaflet from your pharmacist. This medication is administered by a healthcare professional through a vein, usually once weekly. The first dose is given slowly over 3 hours, while later doses may be given over a shorter time. The dosage and treatment schedule are determined by your doctor based on your medical condition, weight, and response to treatment. If you experience symptoms of infusion reactions such as headache, dizziness, flushing, fever, nausea, or vomiting, it's important to notify your doctor or nurse immediately. They may adjust your treatment or prescribe other medications to help prevent these side effects. It's crucial to follow your doctor's directions for all of your medications. Using this medication regularly is important to get the most benefit from it. You can mark the days on the calendar when you need to receive the medication to help you remember. And if your condition worsens, be sure to inform your doctor. It's important to remember that Elaprase has been prescribed to you by your doctor because the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to Elaprase can occur. If you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing, seek medical help immediately. It's important to note that this is not a complete list of potential side effects. If you experience any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor or report side effects to Health Canada. Serious allergic reactions to Idursulfase may rarely occur, sometimes even fatal. This can happen while receiving the medication and up to 24 hours after the infusion. A healthcare professional will closely monitor you during and after the infusion. Seek medical help immediately if you experience any signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. Your doctor may prescribe other medications to treat these side effects. Your infusion may also be slowed down or stopped depending on your symptoms. Before starting the infusion, inform your doctor if you have breathing problems or a fever, as these may worsen during the infusion. Your doctor may choose to delay the infusion or monitor you for longer periods after your infusion to ensure your safety. Before starting Idursulfase, it's important to inform your doctor or pharmacist if you have any allergies or if you have a history of swelling or heart failure. It's also important to inform your doctor or dentist about all the medications and herbal products you are using before undergoing any surgery. If you are pregnant, Idursulfase should only be used if clearly needed, so it's essential to discuss the risks and benefits with your doctor. It's unknown whether this medication passes into breast milk, so consulting your doctor before breastfeeding is important. It's important to be aware of potential drug interactions when taking Elaprase 6 mg per 3 ml intravenous solution for mucopolysaccharidosis. This can affect how your medications work and may increase your risk for serious side effects. Make sure to keep a list of all the products you use and discuss them with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Always seek professional advice before making any changes to your medication routine. If someone has taken too much Elaprase 6 mg per 3 ml intravenous solution and experiences severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control centre for assistance. It's important to keep all your medical and lab appointments when taking Elaprase 6 mg per 3 ml intravenous solution for mucopolysaccharidosis. This will help ensure that the treatment is working effectively for you. Make sure to take each dose of Elaprase 6 mg per 3 ml intravenous solution as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. This medication is administered in a hospital, clinic, or doctor's office and is not meant to be stored at home. It is used to treat mucopolysaccharidosis, a metabolic disease, by replacing the missing enzyme in the body. The dosage and timing of administration will be determined by your healthcare provider based on your individual needs. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.